It's really normal after any period of hospitalisation for people to be at increased risk of low mood. But there's this extra bit with cardiac arrest where you might actually have some slight changes to the brain due to the lack of oxygen that most people experience during cardiac arrest. Now, some people have more severe impacts from that. Some people don't notice any changes at all. It's really different for everyone. But that just in itself can impact on mood and motivation. So when people are recovering, if they're not able to work as much or be as independent, that becomes really frustrating for them. And again, if you're stuck at home, sitting around, disconnected from the life that you once had, perhaps not doing things that used to give you satisfaction and a sense of pleasure, it's quite natural that you'll experience lowered mood. Yeah, lots of people talk about anxiety after cardiac arrest. Sometimes this may have a biological explanation, so it might be again related to changes in the brain or related to the cardiovascular system, because heart rate, breathing and blood pressure are all important parts of the system that contributes to anxiety. A lot of people say that they feel anxious that this will happen again, and for some people it does occur again. They may also have a family member who's worried and reluctant to let them go out on their own and do things like that. One of the things that I see people doing that is potentially unhelpful with anxiety is avoiding going back to their day-to-day routine because they're afraid of what might happen. Avoidance feeds anxiety, so it's natural that you might take things slowly and have a bit of trepidation at first. But if we continue to avoid situations that we find perhaps a little bit nerve-wracking, anxiety tends to grow. So getting back into your normal routine is important wherever you can.